ready to tackle a topic we all think we know, right? Health. But get this, it's way more complex than you might think.
Yeah, it's one of those things we kind of take for granted.
Totally. So we're starting our deep dive with a Wikipedia article on health, and let me tell you, it is packed with fascinating stuff.
Oh, for sure.
Seriously, it's really going to challenge our assumptions about, what it actually means to be healthy.
I think we'll uncover some surprises along the way.
Exactly. So our mission today, well, first we're going to unpack how the definition of health has evolved over time. And then get this, we're going to explore all those factors, all those surprising factors that shape our well-being.
It's really a much broader picture than just, going to the doctor.
Absolutely. Okay, so speaking of definitions, this article highlights the World Health Organization's 1948 definition. You ready for this?
Hit me with it.
All right, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity.
Wow, now that's a mouthful.
Right. Pretty revolutionary for its time, don't you think?
Absolutely. I mean, back then it was really a game changer. Before that, health was all about treating illness.
Yeah.
Purely medical.
Yeah, are you sick or not sick?
Exactly.
No.
But this definition, it really broadened the perspective. It recognized that our physical, mental, and social well-being are all connected.
Mm-hmm.
You can't have one without the others.
It's all intertwined.
Precisely.
But here's the thing. The article mentions that even this definition was later revised.
Oh, really?
Yeah. I mean, do you think that original definition was, missing something?
Well, the idea of complete well-being, it's kind of a utopian ideal.
Yeah, is anyone ever truly in a state of complete well-being?
Exactly. So the updated definition, it acknowledges that health is actually a dynamic process, a resource for living. It emphasizes resilience and adaptability. Basically, it's more about our capacity to navigate challenges, to achieve our goals, and to adapt to whatever's happening around us.
So it's less about achieving some perfect state of health and more about being equipped to handle whatever life throws your way.
Exactly. It's about rolling with the punches.
I love that. And you know what? The article even has this quote. Get this. Health is the extent to which an individual or group is able to realize aspirations and satisfy needs and to change or cope with the environment. I know it's a lot, but it really highlights that dynamic nature of health, What do you think about that?
I think it drives home a crucial point. Health isn't a destination, it's a journey.
I love that.
It's a process of growth and adaptation.
Yeah, and that makes it much more empowering, right? Because it means health is something we can actively work towards. It's not just something we're stuck with.
Exactly. We have agency.
I love that. Okay, and this brings us to a super fascinating part of the article, the determinants of health. It's this whole list of factors that go way beyond, just our physical bodies. We're talking about things like income, education, social support, even the places we live.
Right. It's a real shift in thinking.
Yeah.
For a long time, the focus was all about individual behavior, what are you eating? Are you exercising? But now we're recognizing all those broader forces, those social and environmental forces that shape our well-being.
Yeah.
Let's say you live in a neighborhood with limited access to healthy food options, or there's nowhere safe to exercise. Well, those factors can directly impact your health, right?
Absolutely. And the article actually has some really fascinating examples of how these determinants play out in the real world. So check this out. One study found that people who live in neighborhoods with more green spaces, they actually tend to have lower rates of obesity.
Oh, interesting.
And they also report, get this, higher levels of mental well-being. Who knew trees could be so good for you?
It makes you wonder, right?
It really does. It makes you think about all those subtle influences that are shaping our health without us even realizing it. And it's not just our physical surroundings, right? The article also highlights the power of social connections. There's this study mentioned about seniors, and the seniors who volunteered regularly, they actually lived longer.
Wow, that's fascinating.
Right. It seems kind of counterintuitive because you'd think volunteering would be stressful and, take a toll on you.
You think so?
But I guess that sense of purpose, that connection to something bigger than yourself, it really makes a difference.
It's incredible how powerful social support networks can be. That sense of belonging, the feeling that you're contributing, those are vital components of well-being.
So important. It really highlights how crucial it is to nurture those connections, especially as we get older.
Absolutely.
But now, for a little reality check, the article also delves into some major global health issues. Things like heart disease, cancer, respiratory infections, injuries. they're listed as the leading causes of death worldwide.
Right, sobering.
It really is. Millions of people affected by these conditions every year. And the article also highlights this, like, really stark reality. 1 billion people across the globe, they lack access to even basic health care.
It's a huge barrier to addressing even preventable health issues. Like, we've made incredible strides in medicine, but so many people are still being left behind.
A global challenge for sure.
Absolutely. And it's a reminder that healthcare access is like a fundamental human right.
Couldn't agree more. Now, there's something else in this article that really surprised me. Are you ready for this? Mental disorders are actually the leading cause of disability in the U.S. and Canada.
Wow, that's a big one.
Right. It's a stark reminder that health isn't just about our physical well-being. Our mental and emotional states are just as important.
For sure. And, it all ties back to those social determinants we were talking about earlier. Things like chronic stress, isolation, economic hardship, they can have a huge impact on our mental health.
It's not just about providing therapy and medication. It's about creating communities where people feel supported, where they have the resources they need to thrive mentally and emotionally.
It's a much bigger picture.
Exactly. And honestly, this whole article is really making me rethink everything I thought I knew about health.
It's amazing how much there is to learn about something we think we understand.
It really is.
Welcome back to our deep dive.
We're picking up right where we left off, exploring all those surprising factors that impact our well-being, like from social connections to the environment. And actually, this article, it talks about how, our understanding of health has been totally shaped by scientific discoveries, over the centuries.
It's pretty mind-blowing when you think about it.
Right, like all those breakthroughs in medicine, disease prevention, public health. I mean, it's amazing how far we've come from those ancient remedies to, modern medical marvels. Think about it. Organ transplants, gene therapies. It's incredible.
Absolutely. But, the article also brings us back down to earth a bit. Remember that stark contrast we talked about earlier? The fact that 1 billion people still don't have access to even basic health care.
Yeah, it's a tough reality check.
For sure. It's a reminder that all the scientific advancements in the world, they don't mean much if they're not accessible to everyone.
Totally. And it really highlights the importance of, global health equity, making sure everyone has the chance to be healthy no matter where they live.
Absolutely. Access to healthcare, it's a fundamental human right.
Couldn't agree more. Now, the article also gets into the different levels of healthcare, like primary, secondary, and tertiary care. It's kind of like a tiered system, right?
Yeah, it's a way of organizing healthcare resources so people get the right level of care based on their needs. Think of it like a pyramid. At the base, you have primary care, your first stop for any health concern. Then, as you move up, you have specialists and hospitals equipped to handle those more complex and specialized cases.
Makes sense. You've got different levels of expertise to address all sorts of health needs.
Exactly.
And speaking of advancements, the article mentions that whole shift from, paper medical records to electronic systems. What are your thoughts on that? I've heard some people express concerns about privacy and, data security.
Yeah, those are definitely valid concerns. But, electronic health records, they do offer a lot of potential benefits. For example, they can really streamline communication between healthcare providers, which, helps reduce errors. Plus, they can provide a much more comprehensive overview of a patient's entire medical history.
So, imagine a specialist being able to instantly access your primary care doctor's notes, all the test results. That kind of seamless information sharing could really improve the quality of care.
Exactly. It's all about finding that balance, right? Using technology to improve healthcare while making sure that patient privacy is protected.
Makes sense. Okay, so now, shifting gears a bit. The article highlights the role of public health, preventing disease and promoting well-being, but on a, population level.
Right. It's about protecting entire communities, not just individuals. We're talking things like vaccination programs, initiatives for clean water, campaigns to encourage physical activity.
It's all about those big picture efforts that, often fly under the radar, but they have a huge impact on our lives.
Absolutely. Think about the impact of, those widespread vaccination campaigns. I mean, they eradicated diseases like polio.
Right. And clean water initiatives, they prevent the spread of so many infectious diseases.
Exactly. Public health is all about those preventive measures, those safeguards that protect entire populations. And, the article even mentions that our life expectancy has significantly increased in the past century. And that's thanks in part to public health efforts.
And that's amazing. Really shows the power of, working together, focusing on prevention.
It might not always be glamorous work, but it's incredibly effective.
Totally. So we've got public health focusing on the big picture. But the article also emphasizes the importance of, self-care. It's about individuals taking charge of their own well-being.
Self-care is about those daily choices we make, the things that contribute to a healthier lifestyle. It's about nourishing your body, moving your body, and prioritizing sleep.
The fundamentals.
Yeah, exactly. The foundation of good health. And sometimes I think we underestimate the power of these simple habits. It's easy to get caught up in the latest fads and quick fixes, but really it's those consistent everyday choices that make the biggest difference over time.
It's the long game.
Exactly. And remember, self-care isn't just about the physical stuff. It's about nurturing your mental and emotional health too. Remember that study about the seniors who volunteered and lived longer, engaging in activities that bring you joy, having strong relationships, finding your purpose? That's all part of self-care.
Taking a holistic approach, right? Recognizing that our mental and emotional well-being, they're just as important as our physical health.
Absolutely. It's about cultivating that sense of balance and resilience that helps us navigate the ups and downs of life.
This deep dive has been so eye-opening. We've covered so much from the evolution of health science to the importance of public health and, the power of self-care.
It's amazing how interconnected it all is, right?
But there's one more piece of the puzzle we need to explore, and that's the impact of our work environments on our well-being.
It's often overlooked,
Yeah.
but it plays a huge role in our overall health.
For sure. Can't forget about occupational health. So we'll dive into that in part 3, along with some final thoughts on this whole journey into the world of health. Stay tuned.
Welcome back, Deep Divers. We are in the final stretch of our exploration into health, and we've saved a super important topic for last. Occupational health. It's funny, I spend so much time thinking about eating healthy, exercising, all that, but I never really stopped to think about how my work itself could be affecting my health.
Yeah, it's easy to just assume our workplaces are safe, But this article, it paints a different picture. It really does. I mean, I guess we all know about those obvious risks like back problems from heavy lifting, stuff like that.
Right, those are the ones that come to mind first. But there are a lot of less obvious hazards lurking in our work environments, too. Things we might not even think about.
Like what?
Well, think about exposure to chemicals, like in manufacturing or agriculture, or even something as simple as sitting for long periods, like in an office job. That can lead to all sorts of problems. Musculoskeletal issues, heart problems, even mental health challenges.
Oh, wow. I never really thought about sitting that way.
And then there's stress. Overwork. That can take a huge toll on our mental and emotional well-being. Burnout, anxiety, depression, those are all serious health concerns.
It's kind of scary when you start thinking about all the ways our jobs could be impacting our health. So what can we do about it?
Well, thankfully, there's a whole field dedicated to this, occupational health. It's all about making work environments safer and healthier for everyone.
Okay, so what does that look like in real life? What kind of stuff do they actually do?
A lot of different things. They might do ergonomic assessments, to design workstations that are more comfortable and reduce strain on the body.
Okay.
Of course, they also focus on safety protocols to prevent accidents. And they might develop programs to promote mental well-being, especially in those high-stress jobs.
So it's not just about, wearing hard hats and safety goggles.
Nope, it's much broader than that.
Right.
It's about considering all those factors that contribute to a truly healthy and supportive work environment.
Got it. So to make this happen, it sounds like it takes a real team effort, right?
Absolutely.
Yeah.
Employers and employees have to work together. It's a two-way street.
Right. So employers, they need to step up and provide safe and healthy workplaces.
Exactly. That's their responsibility.
And employees, well, we need to be aware of those potential risks and, speak up if something isn't right.
Absolutely. It's about advocating for your own well-being.
Now, this article mentions that a lot of governments have organizations, dedicated to worker safety. What are some examples of what they do?
Well, here in the U.S., we have OSHA, the Occupational Safety and Health Administration. They set workplace safety standards, and they enforce them. They do inspections, they investigate accidents, and they provide resources to help employers create safer workplaces. And then in the UK, you have the Health and Safety Executive, or HSE. They do a lot of the same things.
So it's good to know there are systems in place to protect workers from those, more obvious dangers. But what about those trickier issues, like stress and overwork? Those seem harder to regulate.
You're right, those are tough ones. Addressing those challenges, it requires a more holistic approach. It's about creating a work culture that prioritizes well-being, where there's work-life balance and resources to help people manage stress. It's got to be a priority.
It's about shifting the mindset, right?
Yeah.
It's not just about preventing accidents. It's about actually creating a culture of health and well-being in the workplace.
Exactly. And I think more and more employers are realizing that a healthy workforce is a more productive workforce.
Makes sense. Happy and healthy employees are going to be more engaged, more productive.
Absolutely.
Wow, this has been quite a journey. We started by unpacking the very definition of health, and we ended up exploring so many different factors, everything from our genes and our lifestyle choices to our social connections, the environments we live and work in. It's amazing how it all connects, how much bigger it is than we often realize.
It really is. And, if we zoom out even further, it becomes clear that health is not just an individual responsibility. It's a collective one, too. We need communities and systems that support well-being, at every level.
So as we wrap up this deep dive, what's like the one thing you hope our listeners will take away from all of this?
Well, remember that quote from Hippocrates. If you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places where they live. It's a powerful reminder that our health is intertwined with the health of our environment and our community. So I want to leave you with this question. How can you use this knowledge to make choices that promote not only your own health, but also the health of those around you? What small steps can you take to create a ripple effect of well-being in your own life and in your community?
That's a great question to ponder. Thanks for joining us on this deep dive into health. We hope you learned something new and feel inspired to, take a more holistic and proactive approach to your own well-being. Until next time, stay curious and keep exploring.